Minister, the extension of emergency health legislation is a serious matter, and so too is our progression through this COVID pandemic with all of its associated challenges. And at present we know there's approximately 3,500 healthcare workers or professionals who are out of work, and that itself is putting a burden on our community and hospital stats. And beyond that, we know that 40% of those in hospital are doubly vaccinated. But in actual fact, I think that figure is higher. In UHW at the weekend, of 18 COVID patients in the hospital, 15 were doubly vaccinated. And I think that points to what we all know is that vaccines are waning. And I therefore ask the question, Minister, the decision to offer boosters to healthcare workers is welcome, but I would say it has been unduly delayed. And if you follow, which I'm sure you do, the reports from the CDC, they have weeks ago recommended booster vaccine for healthcare and for those vaccinated over 6 months. And I'm just wondering, how long are we going to wait for NIAC to put this into place, Minister? We still have quite likely record transmission rates in our schools, although we cannot say definitively because we are not doing any testing regimes in place anymore. And in a lot of cases, the symptoms are misunderstood by parents who have been sending their kids when they should have been keeping them at home. No HSE, no HSA activity on site, Minister. We have many classes with less than half the students attending and many teachers out due to COVID being designated COVID close contacts. And Minister, something we've touched on so many times, antigen testing. Now, I give you a story. My sister-in-law is in the UK and she's a school secretary, and they have been antigen testing in community there for almost 8 months now. And at the start of it, they were bringing the kids into the school halls and doing rapid testing on the children before they were letting them into school. And they have managed to keep all of their schools operational with very little fallout from COVID. And yet we have had 3 reports now, Minister, on antigen testing, and we're still getting about it. And what about the vaccine hesitancy in the community? You need a COVID certificate to go into a nightclub, but you don't need one to go and visit somebody in a nursing home. We still have unvaccinated healthcare people in the community sector treating vulnerable elderly patients. And what supports are we providing to community nursing care? Very little, Minister, as you know, because we withdrew them all on the basis that if there was an outbreak, we'd send in the HSA then. We have pressures in our hospital, in our A&E, our ICU, testing and vaccination, and we have the deferral of other activity. And who will call when it's time, Minister, to say we may have to go into localised restrictions? And also the pregnancy, we need a public information campaign as well, you're aware. Over the weekend there was discussions about people undergoing fertility treatments who were being told not to get the vaccine. And the deferral of new healthcare and new health appointments. And Minister, can I speak briefly, which I have sent a question to your department on the NTPF use in University Hospital Waterford. We put an extra €4 billion into the health budget this year, and still there's been no additional recruitment into the cardiac section in Waterford to expand the cardiology hours. And I would ask you, please, Minister, to respond to me on that question as soon as you can. Also on the effects of lockdown, a 30% increase in patients attending with cirrhosis of the liver. So we have problems right across the community, Minister, and we need to see about mitigating them. And the other thing, Minister, antiviral drugs, which have been going around for a while, and one specifically now out by Merck, molnupiravir, which has seen a 50% reduction in COVID deaths in early introduction. And we've made no efforts whatsoever to get into a buying group, as far as I know, Minister, even though other countries are doing that. So we need to do something to mitigate, and we need to keep on doing measures to mitigate this, Minister. And what's more, we need to be doing a lot more than we're presently doing.